Action.
Okay, today we are talking about hemorrhoids. They are also known as piles. In the layman setting, he or she will call it COCO. So we'll explain it, talk about the factors, some factors, signs and symptoms, and then how to manage or even prevent them. So what are hemorrhoids? So hemorrhoids are dilatations or varices or engorgement of the superior or inferior rectal venous plexus. What are some of the factors of hemorrhoids? And this one, I'll break it into two. We have the predisposing factors, and then we have precipitating factors. So for the predisposing factors, we have age, hereditary, sex, either female or male. But in our setting, males are more predisposed or predominantly get hemorrhoids compared to females. Now, to the precipitating factors, we have diarrhea, constipation, and then overuse or abuse of laxatives. So, someone comes to your clinic or office as a doctor and then complains that, doctor, when I go to the loo or when I visit the water closet or the toilet, there is a bright red blood that comes and then it sprays the toilet bowl. Then you ask, wow, is it mixed with stools or it's not mixed? Because if it's mixed with stools, then your mindset changes away from hemorrhoids. But if it doesn't mix with the stool, and the blood precedes the stools, then you know that there is a cause of a hemorrhoid there. So,
Left foot. Left foot.
Okay, so like I was saying, if the patient comes to your clinic or your office and complains that, doctor, when I go to the loo, I see a bright red blood comes a lot and then it sprays the toilet bowl or it's past the toilet bowl, then you know that this is hemorrhoid. But if the stool mixes with the blood, then you have to start looking elsewhere apart from hemorrhoids. Now, what are the classifications of hemorrhoids? Before, in the olden time, we just say internal or external hemorrhoids, but now there's a new way of classifying or staging them. So in stage 1, we have the hemorrhoidal tissue does not prolapse for stage 1. And then for stage 2, hemorrhoidal tissue is prolapsed, but it spontaneously reduces by itself. So maybe you go to the toilet after you finish the toilet, before you finish, you see that there's something has come out of your anus. But immediately you finish, after some few minutes, it goes by itself. That is for stage 2. Now for stage 3, the hemorrhoidal tissue prolapses from the anus, but it cannot go back by itself. So most patients or most clients will push it using their hand so that they can feel comfortable. So that is for stage 3. Now, for stage 4, the hemorrhoidal tissue remains prolapsed. Then when it gets there, you see some patients sitting halfway like that because it's so painful and all, because even if they massage or push it by itself, it doesn't go. It even more makes it more painful. Then you see that they are in trouble for such disease. So that is for the stages. Now,
Very good.
Now, some patients will also come and then they will complain of something like a boil or a tag at their anal region or their anus. And then most of the times when you examine them, you see that the tag is at the 3 o'clock, 7 o'clock, or 8 o'clock. I mean 11 o'clock, 3 o'clock, 7 o'clock, and then 11 o'clock. So this is also it's a hemorrhoid. So normally, when you assess it like that, they won't come with the prolapsed one or the hemorrhoidal tissue that has prolapsed, but they will come with something like, they will complain, I say if you feel like something like that, then you know that these are the locations where you find them. Sometimes you find them all around. Sometimes too, you find them at maybe just one position, either just the 3 o'clock position or just the 7 o'clock position, or both, or even sometimes all the three positions. So when you see those ones too, they are hemorrhoids. Now, someone would say, how can I prevent this? Or if I get this, how do I know that it's a hemorrhoid? Like I said earlier, you see that there's a bright red blood which precedes the stool, which will spray the WC or the toilet bowl. Then when you come to the hospital, we examine you. We'll see if it's the prolapse type or the boil type or the tag type. Then we advise accordingly. But we can investigate and go further by using a proctoscope, where the anal region will put a probe and then examine if there are other conditions. So to examine, to look through the anus and then see, to visualize whatever is in that is in the anus, and then from there we can manage accordingly. Now, hemorrhoids can be prevented. Some people, especially men who go to gym with the excessive lifting of the machines, can put pressure on the intra-abdominal, have pressure on intra-abdominal pressure. I mean, they will have by lifting the metals and stuff. Women who are also pregnant with the heavy intra-abdominal fetus, so they are also at risk. So when you find that you are in that condition, you have to take good care of yourself. Now, you have to also take more water and more dietary foods. I mean, fiber foods. Fiber foods are very good, so that you don't end up getting a hemorrhoid or such sort. Now, this is why we here at Agbeve, if you do that, if you are able to go through all these precautions with all these precautions, you will be free and then stay away. Hemorrhoids will not have a way with you. I mean, it will stay far away with you. So we entreat anybody who is in these categories of predisposing or precipitating factors to be self-aware of this condition, so that they can prevent hemorrhoids. In any case, if you still have it, when you come to our facility, Agbebe Herbal Hospital or Agbebe Hospital. We will examine you, take your histories, examine you, and then advise you accordingly with dietary or diet plans, or how to go about your eating, and then we'll surely find a diagnosis or a solution for you. So basically, that is for hemorrhoids.
Are you true?
Yeah. Oh.